On Med School Radio, we're preparing for the USMLE. Okay, everyone, let's talk about basic normal vitamin D metabolism. If you have someone coming to see you with bone pain and they're in a type of job where they're not getting exposure to the sun, you can imagine that this is a problem with the biochemical process of converting the sunlight into the usable form of vitamin D. So let's basically review this process. So you can imagine the ultraviolet rays of the sun hitting the skin, and then 7-dehydrocholesterol is converted to cholecalciferol, which is vitamin D3. Then in the liver, with the help of 25-hydroxylase, and then it becomes 25-hydroxyvitamin D, and then with the addition of 1-alpha-hydroxylase in the kidney, it becomes the usable or active form of 1,25-dihydroxyvitamin D. Now, it sounds very complicated, but simplifying that is that just remember that the first process after it hits the skin is the 7-dehydrocholesterol, then becoming vitamin D3, and then with the two enzymes of 25-hydroxylase and 1-alpha-hydroxylase, first in the liver, then in the kidney, it becomes the usable form of 1,25-dihydroxyvitamin D. Now, this is, of course, the usable form. This is the one that's going to be worked on by parathyroid hormone when the body is needing calcium. So what are the uses of this form? Of course, for bone, it increases mineralization and remodeling in the small intestine, very important for the absorption for calcium, and in the kidneys for increasing calcium and phosphate reabsorption, and for the parathyroid glands, of course, this would give the feedback necessary in order to start or stop the parathyroid hormone secretion. So this is a very important process to understand, just basically to understand the basics of this biochemical activity, to know why this person is not getting the bone strength he needs, and this is because he's not getting enough sun. This is Med School Radio.